Hi, I'm Dawn Morse. I'm the founder of Core Elements Training. At Core Elements Training, we deliver a day CPD course in dry cupping therapy, which is available as live online delivery or face-to-face delivery. In this short video, I'm going to demonstrate soft tissue release and active movement to the quadriceps region. These are both cupping techniques that could be used in conjunction with other cupping techniques, such as your static cupping, your slide cupping, and your flash cupping techniques as well. So I'm going to be using a 17-piece vacuum cupping kit. Okay, so prior to doing our soft tissue release technique, we need to apply our cups in a static way. So I'm going to apply our massage medium first. So the medium that I'm using here is lotion, but you could also use oil or you could use wax as well. So we're going to be a little bit more liberal with the application of the medium. Okay, because the cups will move slightly as the client moves her leg. Okay, so I've applied the medium. Now I'm going to apply the cup statically. So the more cups we apply to the area means higher intensity for your client. And the closer that the cups are together, that will also increase the intensity. So you need to judge that intensity based on the feedback for your client and also with the amount of tension that is in the muscle tissue. Okay, so you could focus on the rectus femoris muscle, or you could apply the cups to the whole of that quadriceps region. So in this instance, we're going to be applying the cups to the whole of the quadriceps. Okay, so each of these cups so far, I've put 2 pumps into the area. I've cupped Katie before, so I'm used to the amount of tension that she's comfortable with. But with your clients, again, check the colour in the cups, okay? Make sure that they're not going too dark too quickly, and also ask your client for feedback. So how are they feeling, Katie?
Fine.
Excellent. Okay, so I've got the cups on statically now. So what I'm going to do is I'm going to remove the bolster from underneath the knees. And now we're going to just shuffle Katie to the side of the couch slightly. So if you want to shuffle slightly over, and then I'm going to ask the client to hang the leg off the side of the couch. Okay, so you could do the soft tissue release actively or passively. So first of all, it's quite nice to do it passively. So you're guiding the client and showing them the movement that you want to do. So we're flexing and extending at the knee. Then once we've done 2 to 3 of those, we can then allow the client to take charge of that movement. So sometimes when they're in charge of that movement, they feel a bit more comfortable because they can move within their own comfort range. So generally, as a rule of thumb, anywhere from about 3 to 6 of these repetitions should produce that stretch reflex. And as the client's moving that knee, you'll see the colour come up into the cup a little bit more quickly. The reason for that is because we're getting that increased blood flow through the suction of the cups, but also we're getting that increased blood flow from that internal movement as well that the client's doing by contracting those muscle fibers. Okay, so that was soft tissue release, or a variation of soft tissue release with the cups. Now we're going to move on to active movement. Okay, so a similar type of movement, which includes flexion and extension at the knee. So I'm just going to flush first after I've taken those cups off. But in active movement, the client is going to flex and extend the knee, but also I'm going to do slide cupping at the same time. So I'm moving the cup and she's moving the associated joint, which is the knee in this instance. Okay, so I'm going to apply the cup. I could check that the cup isn't too tight first by just giving it a little bit of a movement here or a little bit of a slide, so it should move relatively easily using that thumb and that finger. You shouldn't have to tug the cup to get it to move. Okay, so I know that the cup is on and it's not too tight, but we have got a nice amount of suction there. So now what I'm going to do is ask the client to hang the leg off the couch. And now as she flexes and extends at the knee, I'm now going to slide that cup. Okay, so we could move longitudinally, which I'm doing here, which is in the direction of the muscle fibers, or we could slide transversely, which is across those muscle fibres. Okay, we can see that erythema or that reddening is coming up really quickly. Okay, and hopefully after about the first 2 to 3 slides, it should start to feel more comfortable for the client. Okay, so you're making sure you're getting nice coverage of that muscle area. Okay, then from there, once you finish, then bring that client's leg back onto the couch. We're then going to remove the cup, and then we're going to flush that area out. Okay, so I've just quickly demonstrated application of soft tissue release and active movement using the vacuum cups. If you'd like to find out more about our accredited day CPD course in myofascial dry cupping or dry cupping therapy, then please visit our website, which is www.coreelements.uk.com. You could also follow our YouTube channel. Thank you.